Hello, everybody. Welcome to Juvanni Med Spa, and we are doing our live. Should we start now?
Oh no,
I am starting because I'm starting my live.
Okay, so
All right. Hello, everybody. So we are again going live. Today is a very, very special day for me because today I have like an amazing guest on in my house and also on our podcast. My guest is Dr. Sonia Velez. She is I'm so honored for Women's History Month to be able to bring my own teacher on. She was my program director in residency training. Thank you so much, Dr. Velez, for coming. You have like really kind of made our lives in America. As an immigrant from Pakistan, to be given a chance to do medicine in America is like and under your leadership was like what an honor and what a learning experience it has been. I was always so impressed from you because not only you are like an amazing family medicine doctor, like everything that we always aspire to be as in primary care, but also you were a lawyer and you had a law degree aside from having the primary care. And we always use you taught us medicine in regard to all the medical legal issues that doctors face on a daily basis in America, and that was like really eye-opening for us because I just thought that we just had like such an amazing, unbelievable training because of just the way you structured it for us. But that so for a Women's History Month, that you are such a role model. You're also the Hispanic women leaders, and you were selected for that award also, which I think is amazing. Again, another feather in your amazing cap. So how is everything with the residency program, and what are your feelings as you have like so many youngling doctors now swarming around you?
Well, you know what? Thank you first and foremost for inviting me to be part of this podcast. I'm equally very proud of your accomplishments as an international female who has attained your status as a primary care doctor, as an esthetician, and all the works that you continue to do and provide to the public. And how do I feel? It's a very, very rewarding career for me to actually see and experience and be part of the growth and development of young doctors. You come in as a bud, and by the time you graduate, you blossom into an incredibly competent, caring, and capable family physician. So it's really my honor that I do what I do.
Absolutely, you're and you do very well. That is the thing, the devil lies in the details, and the amount of detail that you put in the thing is amazing. But Doc, we decided to do this because in light of the recent events with the coronavirus, and you were my first go-to I was like, what are we doing in Westchester, because there are so many cases and the way the events are taking place. I thought that this would be a very important presentation where I can have like another family medicine doctor, specialist who deals with these issues not only personally but also in the hospital environment. What would you like to say to your patients and clients, and through your I would like to say the same things to my own viewers.
Right. Well, and first and foremost, I think it's a timely topic, and I thank you for inviting me to be part of this talk. First and foremost, we need for the public to take a deep breath, all right? And I know it's, everything you hear in the media creates a sense of panic, a sense of urgency. But I think if we approach things calmly, first of all, clearly and calmly, we can help avert what has happened in other countries. And number one is not to there are two schools of thought. You either totally ignore it and say, oh, this is just too much hype, and then you have the other extreme that says, oh goodness, I have to do X, Y, and Z immediately. So why don't we meet it somewhere in the middle, right? Because we are generally a pretty healthy group of people, healthy, population. So let's just focus on a couple of things for today's talk. So we'll talk a little bit about symptoms, right? What are the symptoms that we need to be mindful of? And what should we do if we experience a symptom, or if a loved one of yours has those symptoms, right? So let's start off with symptoms. And I'll have to say that things are evolving on a day-to-day basis.
Yes.
3 days ago, the symptoms that were promoted as you needing to seek help included fever, cough, sneezing, short of breath. Now, they just added pneumonia. And that is not to say that this list will not evolve within the next couple of days, because it probably will. The thing is, we're learning from what's happened in other countries and what's currently happening here in the United States. So those are the symptoms, right? So if you start sneezing, are you going to panic and say, I've got coronavirus? No. Sneezing can occur if you have a simple cold, if you have allergies. And what are we approaching? We're approaching spring. What happens in spring? Your seasonal allergies evolve. I suffer from seasonal allergies. So if you sneeze, have napkins. After you sneeze, wash your hands. You have to wash your hands for 20 seconds. Hand sanitizers now are proving to be not as effective. If that's the only thing you have, then by all means. But seek to wash your hands with soap and water immediately after. So, the sneezing gets complicated, you're coughing, you get fever. All right, is it still the coronavirus? It may not. Why? We're also still at peak influenza season.
Absolutely, yeah.
So that alone complicates it. Right? Because what happens? If you've got the flu, what do? You stay home. You rest, drink plenty of fluids. You can, plus or minus Tamiflu. It depends as to when you were diagnosed. But you and eat. You've got to continue to eat well and rest and take Tylenol. So, but you get short of breath, right? That complicates it. That should alert a person that perhaps this is more. So let me talk about the risk groups here, because you and I will probably get the flu. Yes, we'll be miserable for a couple of days, but we'll be fine. But there are certain groups of patients that we need to be a little bit more careful for and should warrant further investigations. And those include the elderly. And now we're seeing that it's not just limited to the elderly, 60 and above. It could be 50, it can be 40 if you have diabetes, if you have heart failure, if you have COPD, any pulmonary lung disease, asthma, sleep apnea is another one. So, those groups are immunosuppressed. Your patient is on chemotherapy or immunosuppression for any other reason. We need to be a little bit more cautious.
Absolutely.
So those are the patients that I would target and say they need to seek immediate medical attention. The others that are young, otherwise healthy, let's face it, we could have probably been exposed to coronavirus already and we not even know it. Right? So stay home.
It's asymptomatic in a lot of people.
Exactly. And the thing is, you can be exposed. That's the difference also between influenza and the coronavirus. You can be exposed to influenza and develop symptoms 2 to 4 days after. With corona, the COVID-19, however, it can be as long as 14 days after. So how is the virus? How do we contract it? How is it spread? Right. Well, the number one is close contact. So they're recommending, CDC, that you keep 6 feet away. Let's face it, you're in a crowded space area in a room. It may be impossible to maintain a distance of 6 feet, but that's the recommendation. Someone is.
I should sit on the other side of the
room. But someone is coughing, so air droplets is another. It's another sneezing, or coughing. And I think what's more important that we tend to forget is that the person can be in a room all alone, sneeze or coughs, and the droplets fall into a surface area. And that surface area is not white. You come over, and there's something on the table that you want to help yourself to. You touch it, and what happens afterwards? It's on your hands. It can be in your hands and not do anything. How do we get it? Because we touch our face. So that's the thing that we're promoting. And I am the first offender. I touch my face a lot. I'm in the office and I'm going like this and like that. Keep your hands away from your face.
I have to wear that dog collar.
Right. You've seen that on social media, right? Exactly.
Don't touch your face.
Right. So again, those are measures. So what do we do with those surface areas? Disinfect. Wow. If you make it a habit every day, it depends. If you live alone, that's different, right? If you've got household members, you want to clean your surface areas with a disinfectant, as you would, as you would anyway. It's just common sense that we should maintain things, not sterile, but as clean as possible. Another item that we forget about, especially for our animal lovers, is our pets. We forget about our animal, the human beings in the household. CDC has not made any recommendations because we don't know enough yet the effects, but think of it this way. Your friendly pet comes and starts licking you as they would, and then your loved one comes home too, and they're like licking that person. That's a mode of transmission, or can potentially be another mode of transmission. So if you come down with those symptoms,
you have to
limit your exposure to your pets for their protection as well as the protection of others in your home.
And it has been contracted from animals.
Exactly.
So this corona started from bats. So it is only serves us to be more careful when it comes over there. What do you think about any supplements that people can do? I know that I always tell my patients that eat real food and make sure that you're sleeping properly and hydrating, and maybe meditate so that you're not so anxious, because anxiety also creates a lot of inflammation by spilling cortisol, and stress is going to decrease your immune, weaken your immune system. So are there any supplements that you would recommend on the side? Because I know, I do a lot of vitamin infusions and stuff. I do the vitamin D for myself orally. But what are your views about any supplementation?
I'll tell you, I'm a big proponent of vitamin C, and I use it for multiple cases. Let's say even for anemia. I give iron with vitamin C because it enhances absorption. Right. You get for colds, vitamin C. Vitamin D is another one that we need to keep in mind to help boost. Because if you're vitamin D deficient, it's just going to add another layer of symptoms and problems. Vitamin B complex is also a good one that we always propose for brain and heart. So if you've got those three in line, people use a lot of the homeopathic medications. I'm not well versed in it, but absolutely, by all means. But this is a critical time that people need to be more mindful of the meals. Don't skip meals. get plenty of rest, and hydration, like you had mentioned, is equally important, if not most important. So I know I'm aware of your vitamin infusion treatments, which I'll tell you, it has been shown to be of great benefit. Not many are good at taking daily supplements.
I know.
Right?
Really don't.
I think the best prevention is doing it daily. For those of us that tend to run out and forget, you know what? Weekly vitamin infusions sounds like a really, really good alternative, and something that we should start thinking about more and more.
I think it should be covered by insurance. I really, sometimes people complain and they're like, oh, this is expensive, and I'm like, yes, it is expensive, but I wish it's so cheap compared to some other medications that you have to actually take when you get sick. And I sometimes end up wondering if we don't spend money on our health, we end up spending it when we lose work because of illnesses.
Well, I think key is prevention. As a family doc, that's the premise in which I practice. 100%. I want to help prevent, and in doing so, I'm keeping my patients healthy.
Yes, absolutely. Yeah, absolutely. That's why family medicine, I always tell everybody, and I'm not normally a snob, but with family medicine, I'm like, this is the best field ever. If you're always thinking, this is like,
I agree.
Amazing. Like you could like literally tailor anything you can, the way you want to practice medicine. Family medicine gives you a chance. I not only trained in primary care, but we went and I did so much dermatology because I was like, okay, I wanted to do dermatology later on. But that it does for so many, and I used to do so much surgery. We used to do a lot of plastics, and I wherever you would send us. So I love family medicine, but the thing is that yes, the premise is always the prevention for all of us. And but I was guys, I will definitely say one thing. Yesterday I was telling her about how when I tell ladies and my patients and stuff, I say that please go and do a vitamin C IV infusion. It's going to boost your immune system. Half the people are not that interested. But when I say, please do an anti-aging vitamin infusion because that's going to make your botox last longer, everybody goes like, yes, when can I come in? It's such amazing.
Get it simultaneously, probably.
I was like, okay, that's the same thing. Those vitamins. So that, but Doc, thank you so much. This was like so very informative. One other questions that I would ask is, what very important thing that you were just mentioning earlier is if somebody starts feeling symptoms, what are they supposed to do?
Right, that's actually a really good question because, the natural tendency would be, I'm going to go to my doctor's office or I'm going to go to the emergency room. What they're now promoting is you first contact your doctor. Call your primary doc on the phone first. Let us guide you as to what the next steps should be. And the reason for that, there are a couple of reasons for that. Number one is if we say, you know what, I need to see this patient, I want you to come in, but at least I can prepare for the arrival of that patient. And by preparation, I mean I can have my staff members be aware, so when the patient comes in, put a mask immediately on the patient, escort the patient to a room where they will be alone, and keep them away from other patients to limit exposure. We don't want patients coming in, coughing and sneezing without any protective gear, and then exposing potentially vulnerable patients in a waiting room. So the same thing applies with the emergency room. Though there is an exception that I think you should not, immediately just seek immediate medical attention is when you start developing short of breath. At the first second that you feel, you know what, I'm not
breathing,
I'm experiencing difficulty, you call 911. You want to, so that they can alert the emergency department that we're bringing someone in with these symptoms, so that the emergency department personnel will be waiting for them and take the appropriate measures to limit any exposures, not only to the staff, but to the other patients in the emergency department.
Wow, that is so important, and I think that makes sense, because if we are fearing that hopefully everything is going to be contained and it's not going to spread as much as we are fearing. But the thing is that if it happens, we don't want the systems to be completely congested, and stay home if you can.
And you know, now that Westchester Department of Health has also opened lines for patients and the public to call. And you know, I've made those numbers available to you.
We're going to post those numbers, and you will be able to see in the comment section, and Pierre is going to add them to our podcast also. So there is for Westchester, there is a number that you can call during the day, and there is a number that you can call during evening. And the number during the day, if you have any symptoms and you have any questions, you can call 914-813-5159. And during evening hours, if you have any questions, the number in the evening is 914-813-5000. We will also post it in the comment section in case anybody needs.
As well as the website for the CDC. They are constantly and literally on an hourly basis updating their website. And it's useful not only for the patients, also for providers, for caretakers. You know, and a question I've been asked is the use of masks. Right?
That is like a very important question.
Yes, the CDC is not advocating and they're not suggesting or promoting the use of masks for everyone, right? And the reason is because we're going to run out of supplies. We need to exercise judicious use of our limited supply. So there are a couple of times that we're going to say you need to wear a mask. Is if you're walking in to an emergency department, to medical office, and you don't have a mask, you can come in, covering yourself, and one will be provided to you if you have symptoms. Another one is, let's say, for example, you're taking care of a loved one who has symptoms, but they cannot wear a mask because it makes their breathing more difficult. Then I would say you would need to wear the mask. We have established protocols in the hospitals now as to which personnel will be using masks as well, because not every hospital personnel can wear masks. Again, you will be guided with just a simple phone call.
Okay, so they tell you over there. What do you think? I also feel that do you do a lot more telemedicine in our offices? Because I feel that at this point we might be coming to a point where there will be a rapid transition into telemedicine stuff, so that we can assess people, and is it HIPAA compliant?
Yeah, that's actually a good point. We don't currently do telemedicine at where I practice right now, but I foresee it probably being considered in the near future, only for especially because of what's going on now. We'd like to see the patient. I will do phone consults. I don't particularly care for them because I believe in looking, listening, feeling, and I like the human contact portion of what I do. But in situations like this, telemedicine has a place. Yesterday I was looking at this option for our clients, which is like a lot of health and wellness oriented clients and stuff. And when we are doing consultations, many times I would do a consultation through Zoom. Which is like which is a face-to-face. It's like very personalized. It's also HIPAA compliant. Good.
The Zoom is HIPAA compliant also. So I was like, okay, I'll just start having those consultations if somebody were to really need it.
There's definitely a place for telemedicine as we continue to evolve. Absolutely.
So I will definitely was food for thought for our future. Because do you feel that this might become like a little worse later in the year? Because I feel that right now maybe the weather change might bring in a little relief from the symptoms and everything.
That's
because most coronaviruses, they die down around April anyway.
Right, but then again, this is new.
Yeah, this is new.
One,
this
right?
is
Influenza. We're still seeing plenty of influenza cases, and let's face it, we've had a pretty mild winter, which has been really good. And yet, what's happened? We've actually appreciated an increased number of influenza cases.
Wow.
Despite immunizations.
Immunizations, one of the reasons immunizations don't work many times, and sometimes is because when they create the the vaccination, it's basically tailored to the last year's virus. But viruses are constantly evolving, and so this year, so now it hardly ever works because it just evolves. The next year is different.
That is correct, but also I still advocate for vaccines because that doesn't mean you're not going to get the influenza.
Absolutely.
But it does reduce, right? And it's you'll get a subclinical case as opposed to a full blown. I will not live without my influenza.
Oh, vaccine. Me too. Absolutely. I tell everybody that when you do the shot, you may still get infection, but you're not going to be sick for 10 days. You'll be sick for maybe like 2 days and or 3 days, and it's going to be minor. Because your body will have some immunity against that virus. Even if it is 30% or 40% protection, something is better than nothing. And also with COVID-19, there is no vaccine currently. So since we do not have a vaccine for the next at least next 6 months to a year, they're not seeing any vaccine. So what do? I mean, in that time, we just have to be proactive. And just keep your eyes open about everything, guys. And any last words of wisdom? What would you tell everybody aside from all of this?
Exercise caution, but remain calm.
Yes.
Right? Panic. What does panic do? It increases our stress level. And what does that do to the immune system? Right? So we're not doing ourselves any good by panicking. Instead, just keep informed. Get onto CDC website. You have CNN that really puts out really very helpful information on an hourly basis. Keep informed. Drink plenty of fluids. Rest. And eat your fruits and vegetables.
Perfect. Doc, before I let you go, my one last request from you is going to be for our Hispanic viewers to give like a small, I know we're not going to do like a whole thing, but I know that. So one of the things also is that we want to make sure that everybody is also understanding and getting the uniform information. So I'll let you tell our Hispanic clients, because that is because I have like 40% of my clientele is Hispanic,
and mine is over 90.
Oh, absolutely, absolutely.
Bueno, una de las cosas que queremos comenzar a decir es hay que mantener calma, ¿okay? Mantenernos bien calmo y informarnos en términos de qué es lo que está pasando con el virus, el COVID-19. Una de las cosas que quiero que ilustrar es los síntomas que debe de estar pendientes, que si en algún momento se lo llega a desarrollar, entonces hay que llamar para médica asistencia. Y eso incluye fiebre, tos, estornudar, corta de respiración o pulmonía. Si llega a sentir estos síntomas, por favor llame a su médico antes de aparecerse a la oficina del médico. Y el motivo de esa llamada es para que el médico y la clínica o la oficina pueda prepararse adecuadamente para su llegada. Y porque queremos evitar contagio a los que trabajan en la clínica o a los otros pacientes que puedan estar presentes en la clínica. También si ve que se pone con corta de respiración, que es bastante profundo, y tienes que ir a la sala de emergencia, que eso es algo que yo le sugiero, por favor llamar antes a la sala de emergencia para que ellos también estén disponibles y preparados para su llegada. Una de las cosas es prevención. Es bien, bien, bien importante prevenir que se contagie. ¿Y cómo podemos hacer eso? Eso es mantener como seis pisos aparte de cualquier persona que esté tosiendo, destornudando. Si sabes que una persona está enferma, obviamente no estar cercana. Y sabes, toda esta información está disponible en español en el website de la CDC. Le vamos a dejar el número también del Departamento de Salud de Westchester, que habrán personas que hablan español, y la doctora Din lo va a poner disponible para que lo tengan, y cualquier preguntas que puedan tener, por favor llamen, que habrá una persona para darle las informaciones.
Thank you so much. I did get a bunch of it, so I could understand. I wish I could speak this fluently. Wow. Anyway, so thank you so much, guys, for watching. We're going to be publishing this podcast on our YouTube channel, as well as it's going to go on our iTunes, as well as our Spotify. So please follow up, and we are going to come back again, probably sometimes before the end of this week again. And if there are any updates, we'll definitely bring Dr. Velez back. All right, guys, take care, and I'll see you soon. Bye-bye.